For counter current system to operate, what were the criteria? Criteria was that there should be parallel tubes. As you can see here, the parallel tubes are there. So descending limb parallel to the ascending limb, and that is parallel to the collecting duct of the kidney. So all these three tubes are parallel to one another, and they are very close proximity with one another. And we have also seen that their permeabilities are different, and if you look at the flow of urine in this different tube, then you will be understanding that the urine flow is in downward direction in the descending limb of loop of Henle, and it is upward direction in the ascending limb of loop of Henle, and again downward direction in the collecting duct, right? So all the criteria are fulfilling at the level of these three tubes, parallel tubes. So counter current system is going to operate. So how this counter current system is going to operate here? I already told you that proximal convoluted tubule, they contain which kind of urine? That is isotonic urine. Now whenever this isotonic urine is flowing at the level of this, look at this yellow color means this is the isotonic urine which has just entered from the proximal convoluted tube into the loop of Henle. For the first time, suppose this urine has entered. So what is going to happen next? There will be reabsorption of sodium and chloride gradually. Now sodium and chloride reabsorption occurs in which part of the loop of Henle? We all know the main sodium and chloride reabsorption occurred at the level of TAL, thick ascending limb of loop of Henle. Although potassium reabsorption also occurred, but potassium secreted back in the lumen, so that's why you are not considering potassium here. But as you can see here, gradually more and more sodium and chloride is reabsorbed by not only the TAL, but little bit of sodium is also reabsorbed at the level of ATS. So that's why all this sodium and chloride will be reabsorbed gradually from ascending limb of loop of Henle. So that's why I told you the most important part of the loop of Henle where the counter current multiplier system operate is which part? Ascending limb of loop of Henle. Which part? The thick ascending limb of loop of Henle, and the least contribution is by thin ascending limb. Next, what is going to happen? Apart from this sodium and chloride reabsorption, okay, now suppose the sodium and chloride reabsorption has done. Now the urine is going to flow in the remaining part of the nephron. That means now the urine has flowed up to the level of this collecting duct. Now at the level of medullary collecting duct, one important substances is going to be reabsorbed, and what is that? It is written here, the urea. So whenever this urine is further flowing at the level of collecting duct, so collecting duct is going to reabsorb more and more urea. Which part of the collecting duct? The medullary collecting duct, means deep inside the medulla. Urea reabsorption is going on from the medullary collecting duct region. Getting my point? So sodium and chloride reabsorption has already been done, and all this reabsorption, after reabsorption, all this sodium and chloride, where they has been put into, all this sodium and chloride is present now inside the medullary interstitium region. Now when that urine is flowing further, the medullary collecting duct is reabsorbing more and more urea. So what is the net result? The net result is that because of the absorption is huge amount of sodium and chloride and urea, now your medulla is getting huge amount of osmotic substances. What are those? Sodium, chloride and urea. And because of the presence of this sodium, chloride and urea, now all this sodium and chloride and urea is present at the level of medullary interstitium. But urea is not present in the superficial region of this medulla. Urea is only present at the deeper region of the medulla, and sodium and chloride is present throughout the medulla. So what will happen? There will be increased osmolality of this medulla. Why? Because sodium, chloride and urea is there. But that increased osmolality, obviously it will be more than 300 milliosmol per liter. But do you think that this 300 milliosmol per liter, more than 300 milliosmol per liter, it will be equal in every part of the medulla? Answer is no. Whenever you move from superficial to the deeper region of the medulla, more and more tonicity will be there, because there will be additional reabsorption of urea from the medullary collecting duct region. So that's why if you look at the tonicity of the medulla, there is a gradient of tonicity from the superficial to the deeper region. There will be gradient of tonicity inside the medulla, where the lowest tonicity will be towards the cortex and the highest tonicity will be inside the deep inside the medulla. So that's why look at this number 300, that is very close to the cortex, then it is 400, 700, 900, 1000, 1200, 1400. So the maximum tonicity is the inner medullary region. Okay, and what can be the maximum tonicity in case of human kidney or osmolality of the medullary interstitium? That is 1400 milliosmol per liter. So this 1400, some of the books are saying 1200, but as you can see here that there is a gradation of tonicity. Tonicity is not equal everywhere in different part of the medulla. It is lesser in case of superficial part of the medulla, and more you go inside inside the deeper region of the medulla, the tonicity is increasing. This kind of gradation of tonicity or increased tonicity of medulla, this is known as the corticomedullary osmotic gradient. Corticomedullary osmotic gradient. So from the cortex to the medulla, if you go, there is a gradient of tonicity, there is a difference of tonicity, and this is known as corticomedullary osmotic gradient. And believe me that the generation of this corticomedullary osmotic gradient, the generation of this corticomedullary osmotic gradient is done by which system? The counter current multiplier system. So the counter current multiplier system, I told you already that what is the basic aim of the counter current multiplier system is to generate the hypertonic medulla.